about leadership, which is what we're talking about today, I thought it really had to do with just getting people to care, and the rest takes care of itself. And that that was brought home to me on the very first project that I went on, which was an organization based in California that had 40,000 people around the world. And my thinking, very naive, really evolved with the first project that I went on. And the COO of the organization's name was Henry. Henry wanted to change the culture, and he was smart enough to know that being the head of all operations, he owned the culture, because you'll never create safety as really a cultural value if you delegate it to the safety professionals. So he owned it and he knew that, and he cared a lot about safety. But a few weeks after we started working with him, we learned that he woke up in the middle of the night and had to use the restroom. And his wife shared the story that when he left his bedside, he must not have seen the magazine on his carpeted bedroom floor. And when he slipped on that magazine, he had his head on the nightstand. He went to the restroom and eventually back to sleep, not realizing he was internally hemorrhaging, and he passed away in the middle of the night. And I learned that safety is not just about getting people to care, and leadership's not just about caring for the people. We have to help people know what to do, and what risks we're associated with, we're facing, what to do when we face those risks, and then make it easy to always take those precautions with the risks. So that became when safety was really brought home to me, and I changed my whole philosophy around what I thought our role is as safety professionals. I mean, you're more likely to get injured outside of work than you are at work in most of the world. But my role and everything changed. And then over the years, in 2009, I became the president of the firm. And then in 2021, became the CEO with the retirement of our founder. But I'll go back to the thing that has always really stuck with me that maybe we'll talk about here today is when I got my first tax paying job, I like to say, because I've had a job since I was 10 years old. My first tax paying job, my father told me that no one will ever owe you a job. You have to show and demonstrate new value every day. So it's about value creation and value contribution. And that's what I think has been my differentiator and helps a lot of us succeed and move into those leadership roles is when we're perceived as not just the doer and the owners and the most knowledgeable about regulations, we're the ones that are helping people accomplish objectives and creating value for them.
My mic is mute. So can you hear me now?
Yes, thank you.
Perfect. So I think so in our career as a health and safety, the main thing is this that we should be helping the organizations to achieve the goals. A lot of people think that health and safety guys are just like a police and they're gonna stop the job and all what they got to do is to stop the job, but it is not like that. As you said that to progress well, it is important to help organizations to grow, to achieve the goals, but in a safer manner. So, Sean, so every career has the moment that changed the direction. So, what were some key turning points in your journey that helped you to move from the technical role into the leadership role?
I think it goes back to what I was saying earlier that I recognize that am I creating value? And 20 years ago, when we sat down, my former partner and I, when we sat down and looked at how do we want to be perceived? What is it we want to do? How do we want to create value within the world and within the space of occupational safety? That's what became kind of our North Star, our focus. And we one of the things that really changed is when we were working with an organization and we were asked by the head of the organization to help them create a strategy around safety because they went to each one of their business unit areas within safety. It was a large multinational organization, and not one of them could create a strategy. And that was to me a defining moment. And this was probably 15, 18 years ago, is that we started asking leaders, what is the strategy in safety? What does excellence in safety look like? Who's responsible for it? How do we get there? And what we would routinely find if you ask the top 7 leaders those questions, you would regularly get 5 distinctly different answers. And that was one of the defining moments where Terry and I realized that we have to change how the profession is looking at safety. And safety has to have a strategy, and strategies about value creation. And a lot of organizations, if they had a strategy, it was what we called the perpetual cycle of avoiding failure. And see if this sounds familiar, because there's four points to this. They look at their incident rate. They set a new incident rate goal or objective. They develop a list of things to do. They do those things, and then they look at the incident rate. How'd we do? And the problem is, with success, you can fall into the correlation causation trap. We're doing those things, we had better results, therefore we had better results because we're doing those things. Maybe, maybe not. I've seen companies have improved safety performance in spite of the terrible things they were doing to their workers. So success sustainably is a byproduct of focusing on value creation, but it can also be a byproduct of suppression of reporting. It can also be a byproduct of just being lucky. So we started realizing years ago, and that's what really thrust us into being different in how we were approaching it, is organizations need a strategy, and failing less can be a strategy, but it's not one that is going to get you long-term success. And one of my clients, Kelvin, said a long time ago, it's weird how safety performance is viewed as a downward trending curve is viewed as a good thing. I mean, the rest of it, you want to see an upward trending curve. And that's where we really started challenging 10, 15 years ago, the idea of leading indicators aren't enough. You have to have value-based indicators. We initially called them transformational indicators, but you can't just measure activity and results and infer the activities you're creating the results. It has to go back to value. What value is being created or yielded from those activities that explains the results? Because if we have great results and we don't know what's producing it, we have to work to manage the luck out. And those types of things really started getting us to think differently, to do differently. And it started creating a whole new space around value creation and strategy that didn't previously exist. And as a result, I've personally looked at more strategy and safety than anyone as of today. And we still have a lot of work to do, but I think the industry as a whole has moved in a really good direction, that the safety strategy has to support the trajectory of the organization, not compete with it. And if we're out there to just stop jobs and shut things down, we're viewed as the necessary evil at best, not as a business partner to the leaders. And that's the mindset that really has to change, and has really helped me. Is not to belabor the point, but if you look at the biggest reason why employees don't invest discretionary effort in what we're trying to do in safety, or leaders don't invest capital, they don't see the value in it. So if we're not doing things they see value in, at best we're just failing less.
Yeah, and that's the most important thing. So because if people don't find a value in it, and people don't engage into it, people don't spend money on it, and especially the leaders, and that's really important. And talking about the strategy, that is also very much required to proceed in the life, and even to proceed in the career. So many safety professionals want to share their knowledge, but they don't know how they can do that. So my next question, which I want to ask you, is what inspired you to start writing the books, and what problems were you trying to solve through your writings?
Well, when we were so we identified a framework many years ago that, and we called it the 5 capacities for safety excellence. And one of those is culture, of course, but the first capacity is the system capacity, and that's broken out into 2 areas. There's prevention capacity, but then there's also recovery capacity, because mistakes are normal in a complex environment. And then there's leadership capacity, engagement capacity, cultural capacity, and then strategic capacity. So the strategic capacity strategy didn't exist. There was nothing that was out there that really told people step by step, how do you go about creating a culture of safety excellence? There's a lot of leadership stuff out there, but there's a lot of fluff, or there's a lot of programs we just baptize or push people through, and we think it's going to be effective without really being thoughtful around the end in mind. Well, what does success look like? And it's not just the absence of failures. And then how do we do things that people see value in so we can create a sense of ownership within them. And then what are we, again, doing around our system? So a lot of that wasn't existing. And what we realized is we're not going to wait for regulation to come up with it because that's never going to happen. People are never going to agree in regulatory agencies what best in class or what success looks like. That's not really the domain that they add value in. So we realized, well, if nobody's going to be out there, we need to start creating it. But it started in 2007 when I was supporting a large organization, dozens of countries around the world, and we were training people to be what we called internal consultants, basically us within their operations. And we were joking how, you know, not all training is going to be sticky. Not all things that you educate people on are they going to remember. So we started recording some of these conversations with their permission, or at least our responses to them. And then we started putting them in this new area that's called a podcast. And we called it Safety Culture Excellence, January 2008. And it was ideas and things, actual tactical things to do around safety culture, around employee engagement, et cetera. And that started the first podcast. And then we realized that people were listening to it that weren't clients of ours. So then had that kind of question about, do we want to keep putting all this stuff out there? And then we realized ethically, yeah, you should. You shouldn't jealously guard ideas if it's going to save a life. So that's what started that. And then just started getting interested. Someone that worked for me at the time started pushing me to start writing articles. But then Wiley, the publisher, in 2011 contacted us and commissioned us to write that book, Steps to Safety Culture Excellence. So we did, and we put our methodologies in the public domain, and it's been taught at several universities. Many of, if not most of the universities that have degrees around occupational safety have it at least in their library as reference material. But that then led to keynotes, and then we realized that there was more we wanted to say on the strategy front. So we wrote a book called Inside Strategy that laid out our methodology, how you create strategy. And then we wrote a book that was published 10 years ago called Forecasting Tomorrow, the Future of Safety Excellence. We made 7 predictions. Fortunately, touch wood, knock on wood, they all came true. So we got pretty good at being able to predict trends that we would see. And then that really just led Terry and now me to be innovative and kind of looking at what are the things that are coming and creating methodology and practical ideas about how you address these emerging risks that are coming, like AI and the proliferation of data centers and everything else. So it's uh, not one answer to this, but once you kind of go down this and you build that muscle and that habit of writing, it's become easier. And now I've had a little over 500 articles published now in just about every safety space and a lot of business. So now it's just something that it's very easy to do, and it's easy to share new thoughts and ideas because I think that's how all progress begins, is by thinking differently. So I'm always challenging my own thinking.
And that's a really important thing. And I think so, to progress in the life, it is really important to think differently. And over here in Oasis, we come up with this idea to think differently about the health and safety. It's not only just the paperwork, or not only the PPs, or just not as a policeman you have to be there. You have to be a partner of an organization to help them progress and move uh, in the future. And a really important point what I got from you, to find the trends. So I think so most of the organizations nowadays is missing this thing. So people are not focusing more on what are the trends. So for example, they have some near misses or incident, but they just keep a log, but they are not getting information out of it. So I think so this could be an improving point for all the our safety professionals who want to progress in the life as a and boost their career. They should start doing this thing. That would be a good thing. Another question which I have is, this is very important part for our audience. So what do you think is what skills or mindset do you think young and mid-level safety professionals should focus on if they want to grow their career higher in the health and safety?
I think if you want to grow your career higher, I take that by kind of moving into leadership roles. And leadership is is something that's earned not by being the best safety technician within an organization or by being the best compliance officer within an organization. It's really about influence. And the way that you grow that is, again, by being of value within the organization, by helping organizations anticipate and identify where things are at, where things are coming. So that means you need to be bilingual. You need to be able to speak the language of operations and safety. You need to move from being, like you said, the police officer. In safety, there's not enough acronyms. So we like to stay up late at night to develop new acronyms to confuse the world. So we came up with one a long time ago that we called Move from Being the Cop to the Doc. So COP is an acronym for Catching Opportunities to Punish, and DOC is an acronym. DOC is Demonstrating Opportunities to Care. That we're out there coaching and helping people be the best, but we have to make sure that we're evolving in our own brand, and that's a really important piece that people miss, is that a brand is how you're perceived. A brand is what people think about you when you're not around, and you need to be intentional about your brand. And years ago, we created a little kind of way to look at this, that the brand of how safety professionals within an organization needs to evolve from what we call being the grunt to the guardian to the guru. So a grunt provides the important value of the documentation, the data analysis, the all the logs and everything. The guardian moves into getting supervisors to feel a sense of ownership. You're getting operations to take a role in this. And the guru is like general counsel within an organization. They're not running the business, but they're making sure the decision qualifiers are adhered to. We're not doing things that are creating unnecessary additional risk that's out there. So the the leaders of tomorrow, they have to realize there's two types of leadership. There's technical leadership and adaptive leadership. Technical leadership is getting people to do things they already know how to do and solve problems they already know how to solve. But real leadership is adaptive. And US military, the Army specifically, created another acronym in the 80s called VUCA, VUCA, and it stands for volatile, uncertain, complex, and ambiguous. That's where real leadership thrives, is the ability to spin up new plans when the situation changes. So we have to be adaptive. And the leaders of tomorrow, moving out of just the technical role into a leadership position, that means leaders need to see you as an ally, a support mechanism. You understand the situations they're facing, but you can help them through those VUCA times, because there always will be VUCA situations that occur. And that means the safety professionals can't just be technicians. They need to be strategists. They need to be thinking strategically. And I define strategy as a framework of choices, trade-offs, or small bets an organization makes to determine how to capture and deliver value. So back to value. So the things that we do need to be of value. So looking at the data, for example, I was at a plant years ago. I looked at all their data. I knew precisely what they need to focus on to prevent the injuries that are occurring. When I got to the plant, I was asking the employees, what is safety focusing on today? What are they giving the most attention to? Every employee told me to say two things: steel toes and housekeeping. Now, both of those are important, but that's what they were focusing their time and energy on and feedback on. Had they been perfect at that, it would have, over the last 4 years, had an 8% impact on their incident rate. So what they were focusing on is not the most important thing. And then the other side to this, if we're asking employees to do new things in safety, because there always will be changes, and if they don't see value in it, they don't like it, or they don't like and respect the person bringing that change, you're going to create resistance to change. So that means people need to understand the why. They have to see the value proposition, how it benefits them, their place of employment, their ability to perform work easier, keep their job, the company thrive, how it supports their family, the people they care about, all of that. And then we have to be respected and seen as a peer. And if we come across like the police officer, don't be surprised when we're not perceived as a peer. If we're the best technical person out there, but we can't translate that into how the company accomplishes their objectives and thrives and grows market capitalization, increases market share, we're going to be perceived as somebody that gets delegated to. And that whole seat at the table is never going to happen because we're not seen as somebody that can speak the business language. And safety is just how you accomplish great performance. It's not something else to do. And if you've designed your system where people think safety is something else to do, you've got a design problem.
Yeah, that's fine. And that's really interesting thing, in my opinion, to have a leadership which is adaptive. If you can adapt the situation, if you can mold yourself and come up with a solution which is good for the organization, it's a good for the people, those who are working over there, it is very important. Because at the end of the day, it is our moral responsibility to help people, those who are working over there. So if I ask you to uh, give me one common mistake you see the safety professional making, that holds them back. So you have talked about different aspects. So if I say in you have worked in 30 different countries, you have a really nice experience. So what do you think is a common big main mistake which all the safety professionals are doing?
I think they try to earn respect and leadership by being the best safety technician versus developing relationships and earning influence. And the way you build those relationships and earn that influence is through being competent, of course, and being confident in how you're approaching and delivering your competency and value to the organization, but also by being a respected peer, and that goes back to trust. When I look at, I've led hundreds of culture assessments across organizations, and two very common opportunities for improvement are more effective communication and building or rebuilding trust. And trust is built through the model called PCB over T, which stands for positive consistent behavior over time. So that means we need behavioral integrity. That means what we do matches what we say. The whole leading by example, walking the talk, and all of that, whatever example you want to use. So I see the common mistake is by being the best competent individual with the regulation, but that also keeps you in that lane that you're not viewed as somebody that's influential if you're not out there relationship building. And there is certainly the systems and the technical and the infrastructure part of safety, but I've also seen organizations that have some of the best systems in the world, but it doesn't translate into actual how work is being performed. So you create a further and further gap within how work is imagined and how work is designed with how work is actually done within the organization. So safety professionals need to be where the risk is. We need to develop relationships and we need to help people develop a sense of ownership in this. And I think, you haven't asked me this question, but I think the most important relationship that we need to build is within the frontline supervisors, because they, in my experience, are the most undertrained, under-resourced, and underutilized within the average operation. Yet they're the ones most directly influential on how work is performed and how the business accomplishes their objectives and how there's a sense of ownership and engagement or disengagement within the workforce. And to me, it all comes back to you definitely need to know your value and your role, whether you're a grunt, a guardian, or a guru, but you've got to establish those relationships because ultimately what you're influencing is what people do when you're not around and when the boss isn't around. And that's a part of everybody's culture, whether they like it or not.
Exactly, and I think so. This is really important. Mostly, I think so. In some organization, it is still the same that safety is being followed till the safety officer is over there or senior management. But it should be the part of a culture how they should behave. So, how do you see the leadership changing today, and what should the safety professionals start doing differently from now on?
I think safety needs to move and evolve from what I call focusing on safety to focusing in safety. So when we focus on safety, that's that old debate of is safety a priority or a value? I've always thought it's got to be both. You have to create the perception that it's a priority first before it becomes the way we do things a real value and not just situational, real core within the organization. But that means we need to evolve from just focusing on to focusing in. So specificity really matters. So going back to what do we need to focus on that's going to make the biggest impact? And that's where data comes in. If your data shows you have more risk exposure or lagging indicators, more incidents and injuries with less experienced individuals, obviously you need to focusing on hiring, onboarding, job shadowing, that approach. But if it's more experienced people or mid-career, that takes a totally different approach. If you're having more events on Wednesdays, well, we need to figure out what's different on Wednesdays, or maybe we need more oversight on Wednesday, or maybe again, there's something within the system that's producing that. So we need data to tell us what we need to focus on, where, within whom, what systems are influencing this, all of that. And then we need to look at how do we change our systems. There's an old saying that your organizational systems are perfectly designed to give you the results you're currently receiving. So behavior is a byproduct. It always is and always will be. So we need to help the leaders evolve from that name, blame, shame, retrain type of old approach to really understanding that behavior is contextual. People do things for a reason. We have to identify the influence on that. And there's four reasons why people put themselves at risk. They don't perceive the risk. I've done it that way, never gotten injured. What's the big deal? They're just not in the habit yet of always doing it that way. We need a lot of reminders and everything. Or there's things that make it difficult or things that make it impossible. And we need to be out there understanding work as it's actually done to remove those barriers. And then finally, we need to help our leaders measure things differently. You can't just measure, as I mentioned earlier, activities and results. You have to measure the interface in between. If we do this, how does it increase what people know? If we do this, how does it increase what they're able to do? If we do this, does it actually change performance in the organization? And if we do this, does it actually translate into better business results? But the leaders of tomorrow also need to be looking at some of these new emerging risks, like again the AI and the data center, psychological safety. There's been a big, fortunately, really big push around understanding the need to develop recovery capacity. So when things don't go to plan, and then finally, what I mentioned earlier, the leaders of tomorrow, we really need to build skills around how do we help the most important people within the organization see value and own their role, and that's at the subculture level. And finally, what I'll say on that is if you want to know how many subcultures you have, it's how many supervisors do you have. That's where at least you have the potential for subcultures to form. And inherently, there's nothing wrong with that unless you're creating multiple safety subcultures within an organization.
I think so. This is a very practical thing to have a look on ground people what they are doing and have them talk more about the health and safety to know understand what is actually happening on the ground. And I really like this term that we should focus on safety, like focus in the safety. That is an important thing. And I got one really interesting term a few days back I was reading. So it was saying that it is important to retain the training, not retrain the people. So that was also something really important. So we'll be just moving towards the last but not the least, I would say, the question of this session. So, Shawn, if you could give one piece of advice to the safety professional who want to grow, lead, and maybe one day want to reach as a CEO level, and what they should do to continue this journey.
One piece of advice, I guess it would be stop trying to own safety, start building leaders who own performance. And safety is just a part of that performance. If safety excellence is to become a reality within your organization, it's going to show up in the middle. It's going to show up where the supervisors are, where they're coaching, where they're removing barriers, where what their influence does shapes the day-to-day reality. So your job is to create the conditions where this becomes the normal, not to be heroic. If we're able to create an environment where a company can build and produce the capacity to be great in safety, that means that we need to stop owning it and we need to help create a sense of what I called shared ownership. And interestingly, when I lead workshops on that book that I wrote called Shared Ownership, I'll ask people to think of a time where you've really experienced shared ownership, where people are working collectively together to accomplish something. I'll ask them to think of a time, and then a little bit later, I'll introduce the VUCA framework to them, and I'll ask them raise your hand if that situation you were thinking of fell into a time of volatile uncertainty, complexity, or ambiguous, and 90 to 99% of the time their hands go up that's exactly that. So if we're going to be successful in our role, we don't need to work to get ourselves out of a job. We need to work to create more value, and we do so by creating more ownership within the organization.
And that's, I think so, that is a very valuable thing. And when we have the sense of ownership, at that point, I think so, people come together, think together, and go home safely. That would be the thing. And the other important thing which I got from your, that as a leader, you should be adaptive. More you are adaptive to the situation, more it is good if you want to proceed, or even if you want an ownership, or if you want the management to think that you are valuable, so you have to be adaptive according to the situation. There is never written, or there is no final line that cannot be raised. That is really good. So Shawn, thank you very much for sharing your journey and insights, and this has been very inspiring conversation, and I'm sure many people listening today will feel motivated and after hearing your story. So, to everyone who joined us today, thank you very much for your time. And if you found value in this discussion, please stay connected for the future episodes of this Health and Safety Wellbeing podcast. And hope to see you soon with the new podcast. Thank you very much for joining. And Shawn, once again, it's a pleasure of ours that you have spared your time for us. And I was just poking you with a lot of information, and I was just asking you, can you prove this and that? So for being so patient, I really thank you for that. And once again, everyone who's live with us, thank you very much for joining.
Thank you, Amir. Thank you, everyone.